Hello everybody, today I'm going to teach you some exercises that are going to be very helpful to recover your range of motion after a mastectomy or after a resection of the lymph nodes. These therapeutic exercises are very useful after 1 to 3 days after the surgery. Make sure to ask your doctor if that's okay. But the faster you start moving, the faster recovery and the range of motion will be easier. That means that you will be able to move your arms with less restriction, and also it's going to help you with the healing process. So they're very gentle. We're not going to work on moving the arms, we're going to work on joints that are close to the body. We're going to start with the neck. So what you're going to start doing this exercise 8 to 10 times, 3 times a day. So we're going to start bringing the ear toward the shoulder. We're going to do it 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. It's very important that you listen to your body. You're going to go to your limit. If you feel any pain, go before pain. You're going to go to the limit that you feel a little pulling, and if you have pain, always try to remember that the pain is a sign to listen. Something is need to be addressed. Now we'll go to the left. 1, 2, you can close your eyes. 3, 4, 5, 6, 7, 8, 9, and 10. So do this 3 times a day. The next one, we're going to move the neck, rotate the neck like to look over your shoulder. It's very important that you involve the movement of your eyes, because when you move your eyes, that's going to help you also to recover range of motion in the daily basis, like for example driving or see who is behind you. So you're going to start rotating to look over your shoulder. So first the eyes go and then your neck. 1, and go to the center. Again, look over your shoulder. 2. Everything has to be very smooth. 3, 4, 5, 6, 7, 8, 9, and 10. And you will notice that every time you can go a little bit farther. But remember, everything has to be gentle, because you are in a moment that the body is healing, so you have to be gentle. And when you stretch the neck, that is going to be transmitted to this area, so it's very beneficial. Now let's go to the other side. Look over your shoulder. 1, and come back to center. Again. 2. Look over your shoulder and go. 3, 4, 5, 6, 7, 8, 9, and 10. Okay, those are very good movement for the neck. That's going to be good for the breast and the upper extremities. Now we're going to go with the shoulders. So what are you going to do? You are going to bring the shoulders toward your ears and down. 1, 10 times. 2, everything gentle. 3, 4, 5, 6, 7, 8, 9, and 10. The next one is going to be squeezing the shoulder blades back. So what you're you're going to bring the shoulders back, 1, and you're going to feel, because you have a surgery that the skin pulls, there's a good feeling. It's a good feeling that you are gentle stretching these muscles. So very gentle is what you need, because you just went through a process where they did some incisions. So it's good to be gentle, because it's something that it's just closing, it's in the process of healing, so it has to be gentle. So you bring the shoulders back to, just to the point that you feel the contraction of the shoulder blades. 3, and here just stretch tiny bit. 4, 5, 6, 7, 8, 9, and 10. And one more exercise is going to be the movement of the elbows, because they are close to the shoulder, and like if you have something here, right, a surgery here, that's going to help also with the healing, to help you also to prevent inflammation. So it's going to be very good for you, for the blood flow to heal better. So you're going to just 1, 10 times, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, so these are good exercises that you can do again 3 times a day. And don't forget to ask your doctor if that's okay, but it's very good. It's very good because like I said, it's going to accelerate the healing, and it's going to help you to release the tightness, and also improve the range of motion, mobility of your arms faster, because you are not keeping the body still. If you keep the body still, it's like letting a spider web to build up, and then the healing process is going to take long. Okay, I hope you like this video. Don't forget to subscribe to my channel, and I hope you keep recovering, and don't hesitate to ask me questions with any doubts, so I could be happy to give you suggestions. And I'm here, Dr. Shrugs, owner of Shrugs Physical Therapy. Have a beautiful day. Don't forget to subscribe to my channel. Bye bye.